taking heart rate, and respiratory rate, pulse sites, temporal, facial, carotid, brachial, radial, femoral, popliteal, posterior tibial and dorsalis pedis. Purpose of taking heart rate. 1. To determine the number of heartbeat per minute. 2. To identify whether the pulse rate is within the normal range. 3. To check abnormalities in rate, rhythm, regular or irregular, and volume. Factors affecting the heart rate. Age, gender, exercise, fever, medication, loss of blood, stress, position changes, and heart disease. Procedure of taking heart rate. Picture. Explanation 1. Inform consent. 2. Wash hands. 3. Apply clean gloves. 4. Prepare instruments. 5. Select a pulse site, usually radial pulse is selected, and position the patient comfortably. 6. Place index, middle, and ring fingers on radial site lightly and squarely over the pulse site. 7. Check the patient's pulse site on the wrist. 7a. Check the patient's pulse site on the inside of patient's wrist, below patient's thumb. 7b. Place 2 fingers using the other hand on the artery. 7c. Do not use the thumb, because it has its own pulse that you may feel. 8. After getting the pulse regularly, count the pulse rate in 1 minute. 9. Inform the test results. 10. Wash hands. 11. Write documentation. Taking respiratory rate. The differences inhaling and exhaling. Inhaling is when oxygen, O2, enters the bloodstream. Exhaling is when oxygen leaves the blood and enters the tissue. Increasing rate. Stress. Exercise. Lowered O2 concentration at increased altitude. Fever. Decrease rate. Certain medication. Narcotic. Increased intracranial pressure. Factors affecting the increase and the decrease of respiratory rate. 1. Inform consent. 2. Wash hands. 3. Position the patient in a comfortable position. 4. Place the patient's arm to the patient's chest. 5. Count the rise and the fall of the chest in 1 minute. 6. Inform the result to the patient. 7. Wash hands and dry it. 8. Write documentation, rhythm, depth, and characteristic of respiration.